So, hello, all people. Welcome back to the series in which I talk about abdomen anatomy. So, I am Balapriya, second year medical student of Govt Sivagangai Medical College, and in today's video, we'll be talking about the inguinal region. So, we all know inguinal region or groin is a junction of anterior abdominal wall and the anterior aspect of thigh. So, this is clinically and anatomically more important because this is a potential site for hernias to occur, especially inguinal and femoral hernias. And the key structure in this region are the inguinal ligament, inguinal canal, and femoral canal, which what we are going to talk about today. Okay, so inguinal ligament. Inguinal ligament is a thick fibrous band extending from the anterior superior iliac spine to pubic tubercle. So this landmarks are the parts of the hip bone, and we also know that the inguinal ligament is a modification of the aponeurosis of external oblique muscle, which you can see here. The folded and downward part of the external oblique aponeurosis. So that is all about its formation, the lower free border of external oblique aponeurosis, and this has 4 important extension or expansions. These are lacunar or Gimbernaut's ligament, pectineal ligament or ligament of Cooper, reflected part of inguinal ligament, and ilioinguinal ligament. These are named according to the location and the site of attachment. So moving on to lacunar or Gimbernaut's ligament. So this arises from the medial end of deep fibers of the inguinal ligament. As you can see, this is the inguinal ligament and this is the medial end. So it arises from here. So this forms the base and gets attached to the pecten pubis. So pecten pubis is a part of hip bone again, which you can see here. This is the pecten pubis, and and this forms the apex. The site of attachment is the apex and the site of origin is the base. So this is the lacunar or Gimbernaut's ligament, and this is clinically important because the lateral margin or the sharp edge of the lacunar ligament forms the lateral wall of forms the medial wall of femoral canal. This is again important because this is the site of weakness in case of femoral hernias. Okay. So moving on to pectineal ligament or ligament of Cooper. Again, this is called pectineal ligament because it is attached to the iliopectineal eminence, which you can see here. It extends from the lacunar ligament posterior aspect and it's attached to the iliopectineal eminence. So eminence is like a protruded part of the bone. It gets attached here, and that is the ligament. We also have reflected part of inguinal ligament. This part, as the name says, it is reflected posteriorly from the medial end of inguinal ligament, and it expands upward and medially, and it lies behind the superficial inguinal ring, which you can see here. So the final extension is the ilioinguinal ligament. Again, from the name itself, we can understand that it is attached to the ilium. So ilioinguinal ligament arises from fibrous band extending from the inferior aspect of the inguinal ligament, gets attached to the iliopectineal eminence again, same as the pectineal ligament. We also have something called subinguinal space or the pelvifemoral space. So this space is between the inguinal ligament and the hip bone, and so this is divided into 2 parts: large lateral part, the one over here, and a small medial part, the one over here. So the large lateral part is called as lacuna musculorum, and the small medial part is called as lacuna vasculorum, because this part contains important vessels, which are the femoral artery, femoral vein, and all that stuff. And this part contains important muscles, which include the iliacus, psoas major muscle. Okay, so the next thing which we are going to talk about is femoral sheath. So femoral sheath is the prolongation of the fascial lining of the abdomen into the thigh, and it encloses the first or the upper 3.75 centimeter of the femoral vessels. So the shape is funnel shaped, and we have the following aspects. We'll talk about the major parts like base, apex, the anterior, posterior, lateral wall, medial wall, and the compartments of the sheath. So starting with the base. So we can see that the base is directed upward towards the abdominal cavity, and the apex here is merges with the tunica adventitia femoral vessels. So vessels have three parts. The vessels contain of three parts, which is adventitia, media, and intima, from superficial to deep. So the superficial aspect of the vessels, as I said, are the tunica adventitia, and it merges with them. And we also have anterior wall and posterior wall. So anteriorly, we can see from this picture itself that it is formed by the fascia transversalis, and posterior wall is by the fascia iliaca. So we have ilium bone and it gives it a, it has the iliacus muscle, and the fascia covering the iliacus muscle forms the fascia iliaca. So and then about the lateral and medial wall. So as you can see here, this is the lateral wall and this is the medial wall, and the lateral wall is straight and the medial wall is oblique, and it is the oblique, and it is being directed downward and laterally. So you can see here comprises of femoral artery, femoral vein, and femoral branch of genitofemoral nerve, and also a lymph node. So we have compartments. So this sheath is divided into three compartments by two anteroposterior fibrous septa, which we can see in this picture. So this is the sheath and is divided into three compartments by two anteroposterior fibrous septa. In the we have three, which is lateral, intermediate, and medial compartment. The lateral compartment comprises of femoral artery and femoral branch of genitofemoral nerve. The intermediate compartment comprises of femoral vein, and the medial compartment is mostly empty, which has lymph node of Cloquet or lymphatic. So this medial compartment is specifically called as femoral canal, which is again a potential site of weakness through which the femoral hernia occur. So as I already said, femoral canal is the medial compartment of the femoral sheath. So this is a short fascial tube, and it is closed inferiorly by the fusion of the walls. And the upper end, it opens into the abdominal cavity. So that is called as the femoral ring, which is closed by a septum, which is called as femoral septum. So simple, it is a tube, let's say. So a tube has two ends, at upper and lower end. So the lower end is fused together. So it has very little importance. It is fused with the walls. I mean, the walls are fused together, and the upper end is it opens into the abdominal cavity, and it is covered by a septum, which is called as femoral septum. So the important content here is the lymph node of Cloquet. And this is clinically significant because it acts as the dead space, provides a dead space for the expansion of femoral vein, which is present in the intermediate compartment during increased venous return. And the boundaries of femoral canal. So it has anterior, posterior, medial, and lateral boundaries. The anterior is formed by inguinal ligament, and the posterior is by pecten pubis. So in the first slide we talked about pecten pubis. It is to which the lacunar ligament gets attached. So anteriorly we have inguinal ligament, and posteriorly we have pecten pubis. And medially, as I said, lacunar ligament, the sharp edge, which we discussed when we talked about the lacunar ligament. And laterally we have femoral vein. So here the lacunar ligament will be present, and this forming the medial boundary, and the lateral boundary is the femoral vein. So finally, talking about the femoral hernia. So femoral hernia is the protrusion of abdominal contents through femoral canal, and this is more common in women because they have a larger femoral ring, because they have a greater width of pelvis, and this usually presents as a globular swelling in the inguinal region, like this in the picture, and it is infralateral to pubic tubercle. As you can see here, pubic tubercle is here and it is inferior to it and lateral to it. So this is clinically important because we also have inguinal hernia, which is completely different in its location. So it presents with a globular swelling in the inguinal region, infralateral to the pubic tubercle, as you can see here, inferior and lateral, below the inguinal ligament. So this is the inguinal ligament. So as I said, the mechanism of femoral hernia is the femoral ring. Sometimes it is weak. So in that case, it acts as a site of potential weakness, and through which the abdominal contents, they protrude, forming the femoral hernia. And this enlargement of femoral ring can happen during pregnancy because of increased abdominal distension that causes the weakness of abdominal muscles, and also cases in which there is repeated coughing, forceful coughing, or repeated straining, which happens during weightlifting. So what happens is the loop of intestine is forced through this ring and enters the femoral canal and protrudes outside. So we'll talk about the cause, coverings, and also strangulation. So talking about the cause, as I already said, it starts with the femoral ring. So from the femoral ring, it passes downwards through the femoral canal, and it protrudes out through the saphenous opening. So saphenous opening is through which the great saphenous vein drains into the deeper vein, femoral vein. So through that saphenous opening, it bulges forward, and the coverings, as you can see here, is skin superficially, and we have the superficial fascia, and then we have cribriform fascia, and then the femoral canal, the fatty contents, femoral septum, and finally the peritoneum. And talking about the strangulation, what happens is sometimes the femoral hernia, it gets stuck, and in that cases it leads to severe abdominal pain, nausea, and vomiting. So this strangulation is released by a surgeon. He releases the strangulation by cutting the lacunar ligament because it forms the medial boundary. So when it is cut, it provides more space and you can release the strangulation. So yeah, and if what happens if the hernial sacs continues to enlarges, it will expand more supralaterally in the superficial fascia, and finally it becomes U-shaped. So yeah, so that is all about femoral hernia. The important thing about femoral hernia, it is more common in women because they have wider pelvis, and also cases like pregnancy. And the other causes include the enlargement of femoral ring and the repeated forceful coughing or straining, all these conditions. So yeah, thank you. Let's end this video, and we'll talk more about other topics in the upcoming videos.